Dr. Nicola here. I wanted to talk to you a bit today about GLP-1 agonists, and in particular, GLP-1 receptor agonists for people with chronic complex illness, such as Lyme disease and mycotoxin illness, which is pretty much all of my patient base at Restore Medicine, which is where I practice in San Diego. So obviously, there's a lot of talk about GLP receptor agonists for type 2 diabetes and overweight, obesity, pre-diabetes, people with risk factors for heart disease. We hear about that all day long. And the GLP-1 agonists, receptor agonists, are amazing for that population. And I have found that they are really have a great role to play in people with chronic illness as well, for reasons that I will explain to you. We are also seeing great results with GLP-1 receptor agonists in people with PCOS, because PCOS is largely an insulin resistance issue. And so we're finding that the GLPs like Semaglutide and Tirzepatide are actually helping people with PCOS and increasing fertility in people with PCOS. So that's an awesome finding as well. So I just wanted to just give a little bit of background information. So GLP-1 receptor agonists, GLP stands for glucagon-like peptide. It is a peptide, which is a string of amino acids that occurs naturally in the body. And what's important to note is that we do have receptors for this all around the body and in the brain as well. And that'll become important for something that I'll share with you in a minute. So we know that people with chronic illness often gain weight. And I have spoken to countless patients who, are doing all the right things. They're eating clean, gluten-free, dairy-free, no sugar, like a low inflammation diet. And it can be really, really frustrating. It can be depressing. It can be just demoralizing for this sort of seemingly uncontrolled weight gain and inability to lose weight. And it's not just a calorie in, calorie out thing that, counting your macros and all of that is going to make all the difference. It's more based on metabolic dysregulation. And that's because we know that chronic infections and chronic toxicities mess with the hypothalamus, they mess with the pituitary, they mess with those centers in the brain that regulate metabolism. And so it becomes this dynamic where, people with chronic illness can be really like just doing all the right things and, moving to the capacity of what they're able. Now, obviously, if someone's chronically unwell, they may not be able to work out and do as much as somebody who's not. But if they're moving their body and doing what they can, then it just becomes a really defeating situation. And this is where I think the GLP-1 receptor agonist can be so helpful. So we know that the GLP-1s can help heal metabolic dysfunction. Okay, so it's a piece of the puzzle. And obviously, there's so much complexity in illnesses like Lyme and mold toxicity, so many bases that need to be covered, if you will. But in terms of metabolic dysregulation, the peptides like semaglutide and tirzepatide can have a really, really important role to play. So they improve blood sugar control. Now, obviously, one of the main things that they do, and one of the main benefits is weight loss. And that's largely also through the improvement in blood sugar control and also in terms of appetite suppression. So the appetite suppression occurs on two different levels. One is the appetite centers in the brain that regulate appetite and satiety. And then also by slowing the transit of food through the digestive system. And so you feel full longer and you have that increased feeling of being satisfied, that satiety. So we also know that semaglutide and tirzepatide help with hypoglycemia because those agonists, the peptides, only stimulate insulin when the blood glucose is elevated. So it helps to keep blood sugar levels more stable. Now, what I hear from people is lots of different reports of like truly healing their relationship with food. So people who do struggle with cravings for sugar, cravings for junk food, it can massively help like that. With these things. And I was talking to one patient of mine who had started semaglutide, and she said, "Oh my gosh, is this how normal people are with food?" She's like, I don't want the cookie after dinner. I don't want the second helping knowing that I'm already full. Like, and those benefits came on pretty immediately for her. So I got some tips for you in a couple of minutes about, how to get the most benefit from semaglutide or tirzepatide, how to, maximize success. But I will say that I am seeing these peptides help people regulate their cravings, regulate binge eating, regulate, just overeating in general or compulsive eating, because you're just not as hungry and you just don't have those cravings for things. And so it does help. It helps the people who are currently doing all the right things to get that metabolic reset and to heal their metabolism. But it also helps people who do struggle with dietary choices, because it just regulates that, and it will make junk food less appealing. It will make the after dinner cookie just not really a thing that you think about anymore. And so I've heard lots of reports like this of people having, less cravings, making better food choices, having an easier time sticking to healthy food choices, and feeling more empowered and less out of control, both in their weight and in their food choices and the way they relate to food, their relationship with food. And so obviously, things like chronic Lyme and mold toxicity, there's a lot of like disempowerment in those conditions. There's a lot of feelings that things are happening to your body and it's kind of out of your control, and you're trying everything you can think about to kind of get a handle on it. And this is one area where it can help just kind of have, provide that sense of empowerment. And I do see these peptides having a positive impact on depression as well. And that happens at a number of different levels. Obviously, if people are feeling good about themselves and feeling like they're taking care of themselves, then that helps to boost mood. But I do also see, sort of on a chemical level, I see improvements in depression with some of these medications. So I do think, and this is what I think is so important for, chronic Lyme mold patients, that some of these sort of accessory benefits over and above simply weight loss and appetite control and blood sugar regulation, where these peptides just really have such a great function. So the next thing I want to talk about, and this is where it gets really interesting, is the regenerative properties of GLP-1 receptor agonists. So when I say that regenerative properties, I mean healing properties for the body. So we see that they have regenerative properties in joints, in cartilage, and ligaments. They can actually help heal the musculoskeletal system. They have anti-inflammatory properties. Now, this is huge, and there's a couple of different things also going on here when we talk about inflammation. But we know that inflammation is such a fundamental part of chronic illness, and we're always trying to modify and moderate inflammation in the body. So the GLP-1 peptides can help reduce inflammation in the body and in the brain. Because remember, I said the receptors for these peptides occur throughout the body and in the central nervous system. So they can help to moderate inflammation in the body and have a positive impact on neuroinflammation. And that's really great news, because that's so, so key. We also know that there's a reduction in inflammation, because if, really rubbishy, crappy food isn't appealing anymore, rubbishy, crappy processed foods are the most pro-inflammatory. They stimulate inflammation in the body. So if we can do away with the cravings and the tendency to go for those the pro-inflammatory foods, obviously that's going to have a benefit as well. And, we also know that excess weight puts more strain on the musculoskeletal system. So losing excess weight can take some of that strain off. And that also helps the musculoskeletal system and gets inflammation down in the body. So I was chatting with a patient of mine, long-term patient. She's done treatment for mold and Lyme, and she's, functional and mostly doing well in life. But she started semaglutide a year ago, and I talked to her, and she's lost 40 pounds, and she feels amazing. She said her joint pain has resolved, her fatigue has resolved. Like, she feels great. She feels like back to her old self that she barely actually could even remember, and she was just thrilled. So I'm seeing this a lot, and I'll talk about dosing in a minute, but it doesn't take a high dose to have these positive effects. And so we can dose lower and keep side effects to an absolute minimum. The majority of my folks taking semaglutide or tirzepatide have no side effects whatsoever, no negative side effects. They have positive side effects. So we'll talk about that in just a minute. So the effect of these peptides on inflammation, their ability to act as anti-inflammatory agents in the body, is one of the huge things that makes them so relevant to people with chronic Lyme and chronic mold toxicity. Now, what these peptides, or who these peptides are not good for, is people who are willingly sitting on the couch, eating pizza, not exercising, not taking care of themselves at all, and just saying, oh, I'd love to be able to sit here and eat pizza and lose weight. That's a no-go. And I won't actually support a prescription in that context, because that's not the correct use for these peptides, for these medicines. The correct use is in people with prediabetes, type 2 diabetes, or people who need to lose weight and are doing the right things, or need a leg up to get to the place where they're able to do the right things, right? So maybe, in terms of like, if people are still eating junk food or processed food, but they know they want to shift, and they're willing to shift, and they're willing to do the work to get to a better dietary status, to get to a better level of metabolic health, then the GLP-1s can help get them there. Okay, but what I don't support is people who just want to be able to sit around and lose weight, and aren't willing to make any diet or lifestyle changes. So the other thing that I love is, and just moving on now to dosing and strategies for getting GLP-1. So I use only compounded semaglutide and tirzepatide. And there's a number of different reasons for that. One is that the prescription medications like the Ozempics and Wegovy's and such are extraordinarily expensive if they're not approved by insurance. And so if we're using GLP-1 agonists in people who don't have a solid diagnosis of type 2 diabetes or meet the criteria for insurance coverage, then the compounded versions are way, way, way cheaper. We're looking at maybe $200 to $300 a month, as opposed to sort of upwards of $1,200 a month for the brand names. The other thing I like about compounding is our ability to control the dose. So let's take an Ozempic, for example. It comes in a pre-fill pen, if you will, injectable pen. And so you're getting that dose. Whatever is in that pen is the dose that you're getting. There's no flexibility to start with like really teeny tiny doses, as I have in some of my patients. And so we have the ability to control the dose. And that's important first for starting really low and titrating up gradually, which is one of the key features to minimizing side effects. And the ability to microdose for maintenance, which is something that I have explored and found success with for myself. And I'm starting to utilize in some of my patients. So we know that compounding, it's a pretty consistent and reliable supply. I know the Ozempics and Wegovy's they were hard to get for a period of time. And also I like not taking that supply away from type 2 diabetics and people who, who really truly need that consistency of supply. But a lot of it comes down to the flexibility to control the dose, and then also the cost differential in compounding is fairly tremendous. It does come already constituted, so there's no need to get the sterile water and put it in the bottle, and that can get a bit tricky for people. It does come constituted, and so it just gets drawn up into an insulin syringe and done by subcutaneous injection, which most people find very simple process. So let's talk about side effects for a minute, because I know that's usually one of the questions that comes up. So the most common side effects with these peptides is GI side effects. So there can be some nausea, there can be even vomiting in some people, there can be constipation, diarrhea. I have truly, honestly honestly found that by starting people on very low dose, we have been able to circumvent some of those side effects. Very, very few of my patients have experienced any problem at all. I have had one patient who also got some headaches and fatigue, sort of didn't feel like himself with the peptides. So for him, we're moving from semaglutide to tirzepatide just to see if that is any more successful. But it really has been an absolute distinct minimum of side effects that I have seen. So building the dose slowly, starting really, really low is helpful. I also use a GLP-1 specific probiotic, which helps to kind of activate and boost the effects of the semaglutide, but also can help with some of the GI side effects as well. So that's something that I have found very helpful. So let's talk about some tips for success. So I've mentioned this already, start low dose and build up gradually. We typically go up one sort of dosing increment every month. So it's pretty slow going. The dosing is once a week. It's just once a week, a subcutaneous injection. And we're starting at really low doses, like 0.25 milligrams, sometimes even less than that. The other thing I would say is be patient in terms of seeing results. So I tell folks, expect 6 to 8 weeks before you really start to notice weight loss. Obviously, as we get to the more moderate dosing, it's going to have a stronger effect, but we don't want to rush in. A lot of people have problems with these peptides because they rush in and they dose too high and they just want results quickly. And so they go sort of all out and go gung-ho. That is not the way to get success here. It's the way to get side effects and to feel rubbish and to not want to continue anymore. So this is a long-term strategy. GLP receptor agonists have been found to be safe and effective long-term. So while if you start one of these peptides, you are certainly not then tied into it forever. You can go off so long as you have worked on your metabolic health throughout. You can then discontinue, or you can do maintenance on a microdose, which is kind of what I've been doing. But they are effective long-term. And so for some people, they may become part of a long-term health strategy. I know for me, for example, I use certain hormones long-term. I'll take thyroid for the rest of my life. I don't quite happy to do that. Keeps me balanced, keeps me feeling good. And for me personally, I see semaglutide the same way. So I might microdose this forever. I might not, who knows? But right now, it's been a year and I feel amazing on it. And I've had great success. And I feel like I'm at a really healthy weight and working on, lifting weights and doing all the right things metabolically, which is the strategy for success here. So to that note, I coach my patients all the time. You have to be extremely intentional about eating protein. Okay, so yes, when you lose weight, you can lose muscle as well. That is true of any weight loss strategy. So to reduce that, we want to do two things. One is to eat plenty of protein and be really intentional about it. And the reason I say be intentional about it is because when your appetite is low, sometimes you don't want to eat protein. Sometimes you want a baked potato with sour cream on top, right? But you have to be intentional about getting that protein in. So that's one of the keys to success. The second is to lift weights. And I know I'm talking to a population that may not have that capacity or may be very limited in that capacity, but do what you can. If you can lift weights, lift weights. It's building that muscle tissue, that lean muscle mass that's going to get you more metabolically healthy. And I tell all my women patients this, even from probably early 40s, certainly late 40s into the 50s and beyond, the key is lifting weights. I think especially as women, we have been trained to do so much cardio. We've been trained to get on the bike and see, oh, you've burned 400 calories, or, see how far we've gone and do cardio every day because that's how we think we're going to lose weight. No, how you're going to lose weight is to lift weights. less cardio, more strength training. Okay. And don't be scared of lifting heavy weights. Obviously, if you're new to it, you want to, get into it gradually. You want to be sensible about it. Some people coming out of chronic illness need to really do a lot of reconditioning work because they have been sedentary for a while. But trust me when I say this, lifting weights is crucial. It's a non-negotiable. So I love the GLP-1 agonists. As with any medication, there's nothing that's going to be perfect for everyone. There's very few medications that have no side effects whatsoever. We just learn how to mediate the side effects and minimize them as much as possible. And I figure I've got some strategies to support that. But I do think in people with chronic illness, it's worth considering the GLP-1 agonists, not only to help with weight loss and blood sugar regulation, to get your metabolism back online, that's been all screwed up through no fault of your own, through chronic infections and chronic toxicities, get inflammation down in your body, potentially reduce pain levels, get back to a healthy weight so you feel more energetic. You want to move more because you feel better in your body. You feel more empowered because you're choosing healthier foods. There are so many potential wins here. So we are offering these peptides at Restore Medicine. Like I said, we use compounding pharmacies, and so we can control dosage. We have a safe, reliable, consistent source of these peptides. So if you're interested in getting started, reach out to us. I'll put the contact information below, and give us a call or send us an email, and we can get you set up for an appointment and just go through, make sure you're a good candidate, and get you started to feeling better again.